Before attaching the brace, you must deactivate the spring tension. Turn the green switches to off. Bring the brace as far into flexion as the patient is allowed to move. The hinge remembers the position, and the patient can activate the spring tension in this position. To facilitate attaching of the brace on the patient, adjust the length of all brace straps to their maximum length without unthreading them. Now, loosen the posterior straps on the thigh and lower leg by opening the clips. Now attach the brace to the patient's leg from in front. Ensure that the pivots of the brace hinges match the physiological pivots of the knee. It is possible to adjust the thigh rods to the shape of the patient's leg by using an orthopedic bending iron. Ensure that the hinges are as parallel to one another as possible to ensure wear-free function of the brace. Adjust the straps to the desired length and shorten them if necessary. First, fasten the upper calf strap. Then, fasten the upper shin strap. Fasten the upper posterior thigh strap next to the knee. Fasten the anterior thigh strap further from the knee. Fasten the posterior thigh strap next to the knee. Fasten the anterior thigh strap next to the knee. Fasten the lower calf strap. Fasten the lower shin strap. After fastening the individual straps, check that the straps are the correct length and that the brace is in the correct position, and correct it if necessary. Ensure that the straps are not too tight, so as not to interfere with the circulation. The shell elements are anatomically contoured. You can also shape the shell elements with the hand to the leg contour on the patient. To activate the spring tension, turn the green switches to on and bring the brace into flexion until you feel a slight resistance that you have to overcome in order to activate the spring tension. The spring tension setting is displayed on the CDS housing by a scale from 0 to 15. The ranges above 15 and below 0 are marked in red. To prevent damage to the CDS hinge, the red range in the CDS hinge window should be avoided. Insert the tool as far as it will go into the side hole on the hinge. By turning clockwise, or towards the plus sign, the spring tension is increased, and it is decreased by turning anti-clockwise or towards the minus sign. The intensity of the spring tension must be equal in both hinges. The intensity of the spring tension is not altered by activation or deactivation of the spring tension. The spring tension may be adjusted only in consultation with the treating physician. The intensity of the spring tension can be adjusted to the